Off late, we are seeing a huge spike in young people being impacted by cardiac arrests. It is not uncommon to hear such incidences among people in their late 30s and early 40s. It's a harsh reminder that even for those who appear outwardly healthy, the silent risks of cardiovascular disease can be life-threatening. It's made us at the Pure Zen team reflect not just on how fragile life is, but also on how much we don't fully understand about heart health. Through this video, we unravel some of the key mysteries behind the causes of cardiac arrests, how to watch out for them, and hope to debunk certain myths and raise awareness. Let's begin with the obvious actor in this whole scene, cholesterol. Cholesterol is a waxy molecule that your body can't live without. It forms the backbone of hormones like testosterone and estrogen, builds cell membranes and supports brain function. 25% of your body's cholesterol resides in your brain. It's important to note that cholesterol itself is neither good nor bad. It's an essential molecule your body needs to function properly. However, the way cholesterol is transported in your bloodstream and how your body handles it determines its impact on health. The real question isn't just how much LDL you have, but how it behaves. Cholesterol deposits in arteries only under specific conditions. 1. Endothelial damage. The inner lining of your arteries, the endothelium, is designed to resist cholesterol buildup, but factors like high blood pressure, smoking, and elevated blood sugar can damage it, creating tiny cracks. 2. LDL penetration. Damaged endothelium allows LDL particles to slip into the arterial wall. 3. Oxidation inside the arterial wall. LDL particles react with free radicals, unstable molecules from smoking, pollution, or poor diet. Oxidized LDL is like a distress signal for your immune system. 4. Inflammation cascade. White blood cells rush to engulf oxidized LDL, forming foam cells. Over time, these foam cells, cholesterol, and debris form plaques. Plaque is not just an inert blockage, it's biologically active, perpetuating inflammation and sometimes rupturing, which can cause blood clots leading to heart attacks or strokes. But cholesterol can't travel on its own. It hitches a ride in lipoproteins, which act as carriers in your bloodstream. Here's where things start to get interesting. HDL, high-density lipoprotein. Think of HDL as the garbage truck. It collects excess cholesterol from your arteries and delivers it to the liver for disposal. A higher proportion of protein in HDL makes it high density. Why HDL is beneficial? It clears cholesterol from artery walls, reducing the risk of plaque formation. LDL, low-density lipoprotein. LDL is the delivery truck, bringing cholesterol to cells for repair, growth, and energy. The problem arises when there's too much LDL in the bloodstream or when it becomes oxidized. Why LDL has a bad reputation? Oxidized LDL triggers an inflammatory response in artery walls, leading to plaque formation and narrowing of arteries. Atherosclerosis. Triglycerides. These fats are stored for energy and released when your body needs fuel between meals. After eating, excess calories are converted into triglycerides and transported through the bloodstream. Why high triglycerides are problematic? Elevated levels, above 150 mg/dL, contribute to the formation of small, dense LDL particles, which are more likely to penetrate arterial walls and trigger plaque formation. When combined with low HDL or high LDL, this creates a perfect storm for cardiovascular risk. Cardiovascular health is about more than cholesterol. These 5 markers paint a fuller picture of heart health and risk. First, high-sensitivity C-reactive protein, or hsCRP. What it measures, hsCRP, is a marker of systemic inflammation. Chronic inflammation accelerates the damage caused by oxidized LDL, contributing to plaque formation and arterial stiffness. The optimal range is less than 1 mg per liter, which indicates low risk. 1 to 3 milligrams per liter is moderate risk, and above 3 milligrams per liter signals high risk. Elevated hsCRP often accompanies metabolic dysfunction, insulin resistance, and obesity. What to do? Adopt an anti-inflammatory diet rich in omega-3 fatty acids like salmon and walnuts, antioxidants such as berries and green tea, and fiber from whole grains and legumes. Engage in regular exercise and practice stress management techniques like mindfulness or yoga. Next, apolipoprotein B or ApoB. What it measures. ApoB is a protein found on all atherogenic lipoproteins, including LDL, VLDL, and LPA. Each particle has one ApoB protein, making it a direct count of the number of cholesterol-carrying particles in your bloodstream. Why it matters. The number of particles matters more than the total amount of cholesterol they carry. More ApoB particles mean more opportunities for cholesterol to deposit in arteries. Even if your LDL-C levels appear normal, the optimal range is less than 60 to 80 milligrams per deciliter. What to do? Focus on lowering LDL and triglycerides through diet, exercise, and potentially pathological interventions like medications on advice from a medical practitioner. Avoid trans fats and prioritize monounsaturated fats like olive oil and avocados and omega-3s. Why measure ApoB instead of LDL-C? LDL-C measures the total volume of cholesterol carried by LDL particles, but it doesn't tell you how many particles there are. Measuring the number of particles, ApoB is more predictive of cardiovascular risk because two people with the same LDL-C level can have vastly different particle counts. Someone with fewer larger particles may have lower risk, while someone with many smaller particles is at higher risk, even if their LDL-C levels are identical. For example, person A has an LDL-C of 100 milligrams per deciliter and an ApoB of 60 milligrams per deciliter, indicating fewer larger particles and lower risk. Person B also has an LDL-C of 100 milligrams per deciliter, but an ApoB of 120 milligrams per deciliter, indicating more smaller particles and higher risk. ApoB measures all atherogenic particles, including small LDL particles, making it a better marker of risk. This is why focusing solely on LDL-C can be misleading. ApoB provides a clearer understanding of the true atherogenic potential in your bloodstream. Third, homocysteine. What it measures. Homocysteine is a byproduct of protein metabolism. Elevated levels indicate poor methylation, a critical biochemical process that regulates cardiovascular and neurological health. Why it matters. High homocysteine levels can damage the endothelium, the arterial lining, and increase the risk of clot formation. The optimal range is less than 10 micromoles per liter. Elevated levels above 15 micromoles per liter indicate high risk. What to do? Support methylation by consuming foods rich in B vitamins like leafy greens, eggs, and fortified cereals, or supplements containing B6, B12, and folate. Reduce alcohol intake, which depletes these essential nutrients. Fourth, lipoprotein A, or LPA. What it measures. LPA is a genetic variant of LDL with an added protein component. It behaves similarly to LDL but is more prone to clotting and inflammatory activity. Why it matters. Elevated LPA increases the risk of clot formation and arterial inflammation, compounding the risk of cardiovascular events. Unlike LDL, LPA levels are largely determined at birth and aren't significantly influenced by diet or lifestyle. The optimal range is less than 30 milligrams per deciliter. What to do? While you can't directly lower LPA, managing LDL, ApoB, and inflammation can mitigate its impact. Finally, erythrocyte sedimentation rate, or ESR. What it measures. ESR assesses the rate at which red blood cells settle in a test tube over an hour. Higher rates indicate inflammation or chronic disease. Why it matters. While ESR is a less specific marker, persistently elevated levels indicate prolonged inflammation, which exacerbates cardiovascular damage. The optimal range for men is 0 to 15 millimeters per hour, and for women, it's 0 to 20 millimeters per hour. What to do? Address underlying causes of inflammation, such as autoimmune conditions or chronic infections, with medical intervention and lifestyle changes. High blood pressure, the silent threat. High blood pressure or hypertension is one of the most critical and often overlooked risk factors for cardiovascular disease. Why it matters. Elevated blood pressure damages arterial walls, making them more prone to cholesterol buildup and plaque formation. It also increases the workload on your heart, leading to hypertrophy or thickening of the heart muscle. What to do? Reduce sodium intake, maintain a healthy weight, and stay physically active. Manage stress through relaxation techniques and mindfulness practices. Monitor blood pressure regularly to stay within the optimal range of 120 over 80 millimeters of mercury. Elevated blood sugar levels, a covert culprit. High blood sugar levels, often linked to insulin resistance or diabetes, can accelerate cardiovascular damage. Elevated glucose levels harm the endothelium and promote the formation of small, dense LDL particles. This not only increases ApoB, but also triggers inflammatory cascades. Optimal fasting glucose levels should be below 100 milligrams per deciliter, and HbA1c, which measures long-term blood sugar control, should be less than 5.7% for optimal health. What to do? Prioritize a low-glycemic diet rich in whole, unprocessed foods. Incorporate strength training and aerobic exercise to improve insulin sensitivity. Each marker, HDL, LDL, triglycerides, ApoB, HS-CRP, and others, offers a piece of the puzzle. Together they tell the story of your cardiovascular health. What you can do? Test wisely. Ask your doctor for a comprehensive panel, including ApoB, LPA, and HS-CRP. Eat smart, focus on whole, unprocessed foods rich in fiber, omega-3s, and antioxidants. Move regularly, aerobic exercise improves HDL, lowers triglycerides, and reduces inflammation. Manage stress. Chronic stress raises cortisol, accelerating LDL oxidation and inflammation. Sleep well. Quality sleep supports metabolic and cardiovascular health. Heart disease isn't inevitable, it's preventable. By understanding and addressing the interplay between cholesterol, triglycerides, inflammation, and genetics, we can take proactive steps to safeguard our health.